explained to you before, at the age of 6 months, they come into the mouth until and remains until the age of 6 years. At the age of 6 years, gradually they are replaced by the permanent tooth. One by one, they shed off and replaced by the permanent tooth. By the age of 12 years, the mixed dentition is finished and permanent dentition is there. The common nicknames for deciduous teeth are primary teeth, milk teeth, baby teeth, temporary teeth. These all are common name for the deciduous teeth. Primary teeth, milk teeth, baby teeth, temporary teeth, all of which unfortunately denote a lack of importance. But actually the baby tooth has much more importance that we have to learn in the course of pediatric dentistry. Anyway, in Arabic, I think the tooth is known as Aslan al-Labaniya, right? Aslan al-Labaniya. The deciduous tooth, you see how many deciduous tooth we have here. We have two upper central incisor, we have lateral incisor, we have canine, and we have first molar, and we have second molar. These are the deciduous tooth actually. 5 in each quadrant, 10 in one jaw, and 20 in the whole dentition. This 20 tooth is known as succedaneous tooth, which will be replaced gradually by the permanent teeth. Now, the thing is that the first molar will not be replaced by the first molar. Central incisor will be replaced by the central incisor. Lateral incisor will be replaced by the lateral incisor. Canine will be replaced by the canine. But first premolar will be, actually first molar will be replaced by the first premolar. And second molar will be replaced by the second premolar. These are the two extra tooth in the permanent dentition that is not present in the deciduous tooth. Premolar, first and second premolar. They will replace the first molar, first deciduous molar and second deciduous molar. The permanent molars are non-succedaneous tooth. They will come into the oral cavity behind or rostral to the distal to the second deciduous molar. You see here, these teeth emerge in childhood between the ages of 6 months and 2 years. There are 20 teeth in the deciduous anterior. The eruption time is 6 months to 2 years, but staying time is until the 6 years at least. Okay, which comes at the age of 6 months will go at the age of 6 years, which comes at the age of 2 years will go at the age of 12 years. 10 maxillary and 10 mandibular tooth, central incisor, lateral incisor, canine, first molar, second molar. There are no premolars. Beginning at the age of 6 years, these teeth are gradually replaced by the teeth of the permanent dentition. The deciduous tooth are actually in the mouth, functioning from about 6 months, mandibular central, starting with the mandibular central incisor, to 10 to 12 years. But they play a very important role during the childhood in the proper alignment, spacing, and occlusion of the permanent dentition. When deciduous tooth are lost prematurely, this can cause destructive results and should be avoided. Actually, you will go through in details about the importance of preservation of deciduous tooth in the course of pediatric dentistry, but let me tell you in a nutshell, in short. For example, the space from the deciduous central incisor to the deciduous second molar is limited for the 5 succedaneous permanent tooth. Why? Because at the age of 6 years, the permanent molar comes distal to the deciduous second molar. Then, from the midline of the mouth, the one side and other side, the space is limited for this 5 tooth. So, if the deciduous second molar or any other tooth is lost prematurely, particularly the molars, then the tooth moves mesially. And if moves mesially, there is shortage of space. As a result, there will be crowding or partial or complete impaction of any of the permanent succedaneous tooth that will cause bad effect in the permanent dentition. So what we are doing, if, for example, any deciduous tooth is missing, then we are using a space maintainer. This is known as a space maintainer, supported by any of tooth, mesial, from mesial or distal. We are putting a clip in the space so that the tooth do not come forward. Because if this tooth come forward, for example, if the first deciduous molar is lost or canine is lost, the first deciduous molar, second deciduous molar will come mesially, drifting. This is normal drifting characteristics of the tooth. That so as a result, the total length will be reduced, and there will be crowding in the permanent dentition. Important functions of sound deciduous tooth. Sound means healthy. Efficient mastication of food, maintenance of a normal facial appearance, formulation of clear speech, because if the baby is not having a particular tooth, he will not learn to pronunciate all the particular words. Maintenance of space for the emergence of permanent tooth. This is the additional function that is not present in the permanent dentition. All these three are permanent dentition: mastication, appearance, I mean beauty, and speech. These three function is for permanent tooth as well as for deciduous tooth. But for deciduous tooth, additional function is maintenance of speech for the emergence of permanent tooth. So you see the permanent dentition, primary dentition. This is central incisor, lateral incisor, canine, first molar, second molar. And here this is permanent dentition. This is central incisor, lateral incisor, canine, first premolar, second premolar, then first molar, second molar, third molar. There is a comparison between the primary dentition and permanent dentition here in this slide. Eruption of deciduous tooth from 6 months to 2 years. Pure deciduous dentition at 3 years or are completed. From onwards, usually pure permanent dentition. Okay. So we have pure deciduous dentition, we have pure permanent dentition, and we have a time of mixed dentition. Remember, one question will come from this slide about deciduous dentition, mixed dentition, and permanent dentition. This is the situation of the mixed dentition. You see, the first molar is coming, maybe the central incisor will come soon, other deciduous molars are present in the mouth.
Doctor, we studied this.
What?
Are we? We studied this before.
One
I
by
think
one.
in the first chapter.
First?
We take it in the first semester.
We take in the first semester? In first year, actually, first semester, that is introduction. It was in the introduction of the introductory class, we talk about the residual dentition. We are going in deep for the residual.
Doctor?
Yes.
Is the quiz until here? Until this chapter?
No. Quiz will be up to the maxillary second, mandibular third molar.
The last week, right?
Last week. Until last week.
Okay.
And
4 chapters. I mean 4 chapters.
2 from the first semester. 2 from the 2 lectures from the first semester.
Yeah, and 2 lectures for this semester.
Outline and physiological tooth form.
And the molars this semester.
Yeah, and the molars. Yeah.
Okay, that's good.
Okay, so I will talk about the lecture, about the quiz after the lecture. Okay. So eruption time, you just remember this eruption time, that upper A, lower A, when they are coming at the age of 6 months, then 7, then 8, like this. The 18 canine is coming, upper canine is 18 months, and lower canine is coming at 16 months. Then deciduous D and E, deciduous first molar and second molar, when they are coming, just you should have a good guess about the timing of the eruption and shedding of the deciduous tooth. Okay. Actually, shading is equal to the eruption of the permanent tooth, succedaneous tooth, similar. So deciduous tooth shading and eruption of permanent tooth is the similar time. Characteristics of the deciduous tooth. Deciduous tooth are: number one is smaller than its permanent analogs. Analogs mean the same permanent tooth. For example, the central incisor, deciduous central incisor is smaller than the permanent central incisor. Deciduous lateral incisor is smaller than the permanent lateral incisor, like this. But from the same tooth, it is smaller in size. Whiter, little bit whiter, opaque white. This is opaque white, milk white, and more consistent in shape. There is no variation or anomalies in the deciduous tooth. They are more consistent in shape and size than the permanent tooth. They have shorter crowns with respect to their roots. You see, the root is, for example, 1.5 times in the permanent tooth. Usually, this is 15 millimeter, this is 10 millimeter or 10.5 millimeter. But in case of deciduous tooth, the crown is short and the root is almost double in size. The ratio here was 1:1.5. Here ratio is 1:2. So comparatively, the roots are longer than the crown. The enamel of the deciduous tooth is less mineralized, more permeable, and more easily worn down. The enamel of the deciduous tooth is usually very thin. Worn down means they are wearing and tearing. So you will find in many of the cases at the age of 10 years, 11 years, that the enamel covering on the deciduous molar has been lost and dentin is seen. So many cases you will find like this. So because it is less mineralized, it is not that much strong. You see here, you see, this is the molar, deciduous first molar, second molar. The enamel is worn down, and you can see the dentin here also. You can see the enamels are worn down. The layers of the enamel and dentin are thinner in case of deciduous teeth. You see the enamel layer and dentin layer is thinner than the permanent. Permanent tooth, it is little bit more thick. The pulp cavities are proportionately larger on the permanent than on the permanent tooth. You see the deciduous tooth, the pulp cavity is very big because the thin dentin and thin enamel layer. You see here how many the big layer of dentin and big layer of enamel is present. So as a result, and pulp horns are very high. You see the deciduous tooth pulp horns are very high. So what is happening as a result? 80% of the proximal caries in deciduous tooth causes pulp exposure. As soon as there is a small caries here, immediately it comes to affect the pulp because the deciduous tooth enamel and dentin layer is thin and the pulp horn is very high. That is the reason that the caries easily reach to the pulp. The crowns have a marked constriction at the nape. You see here, this is permanent tooth is gradually coming, but deciduous tooth, it is a abrupt constriction of the nape. The enamel seems to bulge close to the cervical lines rather than gradually tapering. Because in case of permanent tooth, what is happening? The enamel gradually coming thin and thin. From here, enamel gradually coming thinner and thinner, and it becomes knife edge at the neck area, in the cervical region. But in case of deciduous tooth, the enamel does not become thinner in the cervical area, so it becomes a bulb. So crowns of deciduous tooth appear bulbous. This is known as bulbous. On the anterior teeth, there are no depressions or pericymata on the labial surface of the crown of the incisor tooth. There is no mamelon and there is no pericymata. There is a depression, you see, demarcating the three lobes. It is in the newly erupted tooth it is present. So permanent tooth, they have many things, but deciduous tooth, they don't have anything. They don't have mamelon, they don't have pedicymata, they don't have this lower depression. Nothing is there. It is plain and smooth from the very beginning. This is pedicymata usually seen in the permanent tooth immediately after eruption that gradually goes down. This is mamelon. On the anterior tooth, okay, no mamelons in the incisal edge. The cervical ridge on the facial surface is prominent. You see the cervical ridge. This is the cervical ridge. It looks very prominent in the deciduous tooth. Permanent teeth, of course, there is cervical ridge, but in comparison to deciduous tooth, cervical ridge in the permanent tooth is a little bit smaller. But deciduous tooth, it is heavy. This is the cervical ridge. The cingulum is also prominent. You see, the cingulum. This is the cingulum is also prominent in the deciduous tooth. Why? Actually, because deciduous tooth is smaller in size, so even a smaller bulging looks very big in the surface of the deciduous tooth. On the posterior tooth, the molar crowns are narrow buccolingual. This is molar and wide mesodistal. In case of the molar crowns short sorry. Look, in the permanent dentition, we found that the molar crowns are bigger buccolingual than the mesodistal dimension in case of upper molars, right? And lower molars, it is mesodistally bigger than the buccolingual dimension. But in case of deciduous tooth, all the molars are buccolingually narrow and mesodistally bigger, wide. Mesodistally, they are big than the buccolingual dimension, upper and lower both. And the molar crowns short cervico-occlusal. The height of the molar is much more shorter than the permanent tooth. This is buccolingual dimension. The molar occlusal surfaces are shallow, the cusps are short, the ridges are not pronounced, and the grooves are not deep. The buccal cusps are not pointed, their cusp slopes made at a very wide obtuse angle. You see, deciduous tooth, everything is very smooth and small. Okay, so the cusps are also very small, shallow. The grooves are also shallow. The developmental grooves are not that much prominent, and the buccal cusps are not that much pointed. Because in case of permanent tooth, we see the buccal cusps are usually very pointed for the more upper tooth because the buccal cusps are not in function, and in case of lower, the lingual cusps are not in function, so they are very much pointed. But in case of a deciduous tooth, no, and the angle of the cusp is very obtuse, I mean very big, so they are very shallow and blunt. You see here. Grooves or depressions are few in all surfaces of the crowns. Okay, developmental grooves, for example, there are developmental grooves on the buccal surface for the lower first permanent molar. But in case of lower deciduous molar, there is no such groove on the buccal side. So grooves are present only on the occlusal surface, and still they are very shallow and few in number. The root furcation is near to the crown, and there is little if any root trunk. Usually there is no root trunk in the deciduous tooth. You see here, if even it is present, very shallow, but many of the cases there is no root trunk. But permanent tooth, you will see there is root trunk. The roots are very thin. The roots are very divergent, not only thin, divergent and thin. Why? Because they have to make a space for the permanent deciduous tooth germ. So within the root here, the permanent deciduous tooth germ will be here. The roots widely spread to allow for the developing permanent successors. You see here, the premolar tooth is coming from under the deciduous molar tooth. So they are very divergent. So now if we compare the deciduous tooth with the permanent tooth in a table, you can see the number for the deciduous tooth is 20, but the permanent tooth is 32. Size is smaller and permanent tooth is larger. Color, the whiter and permanent tooth is darker. Crowns are more bulbous. Bulbous, that we told you that due to the thickness of enamel in the cervical region, and in case of permanent tooth, it is less bulbous. Mesiodistal measurement greater than cervical-occlusal in anterior tooth, less than cervical-occlusal in the anterior tooth. In the anterior tooth, what happened? The deciduous tooth is much more wider mesiodistally than the cervical-occlusal height. Particularly seen in the central incisor and lateral incisor. You will see central incisor and lateral incisor is very wide, but less in height in the cervical-occlusal dimension. But in case of permanent dentition, the cervical-occlusal height is the biggest in case of anterior teeth, right? Enamel ends abruptly in case of deciduous tooth, and permanent tooth, it is knife edge. Cervical line is less curved in deciduous tooth, almost straight, but permanent tooth, it is more curved. Cervical ridges are more prominent in the deciduous tooth, less prominent in the permanent tooth. Deciduous molars differ than their successors. Actually, deciduous molars are molar, but their successors are premolar. So they are not similar in pattern. Deciduous tooth root is more divergent, and permanent tooth root is less divergent. Root trunk, no root trunk is present mostly in deciduous tooth, but in case of permanent tooth, of course, the root trunk is present. Root crown ratio is longer in case of deciduous tooth, almost 1:2, and permanent tooth is shorter. Length of the root is long in case of deciduous tooth, is shorter in the permanent tooth. Classification of all deciduous tooth is before birth, but permanent tooth is after birth, except number 6, the first permanent molar, which is at birth. Resorption of roots, physiological. The deciduous tooth will go down physiological, not a pathological condition. But in case of, if there is any, if you find any resorption in the root of the permanent tooth, it must be a pathological condition. This must be treated. This is not normal or natural. Attrition rapid, as enamel and dentin is less hard and or mineralized in the deciduous tooth. The deciduous tooth, the attrition is rapid. Permanent tooth attrition occurs, but it is slow and it is not easily wearing down. So this, the same chart has been explained here. These are with more pictures, you can check. You see, this is whiter, this is darker. Types, shape, contact area for the deciduous tooth is smaller, but contact area for the permanent tooth is a bit broader. Permanent tooth enamel is a little bit more yellowish. You see, this is white, this is yellowish. Occlusal area of deciduous tooth is narrow, buccolingually narrower, permanent tooth buccolingually wider. Roots of deciduous tooth are divergent, permanent tooth is bigger, not that much divergent, stronger. Pulp cavity, deciduous tooth is dentin is thinner, enamel is thinner, pulp cavity is larger, pulp horns are high in cusp region. Permanent tooth, dentin is thick, pulp cavity is smaller, pulp horns are lower in the cusp region. Placement in the jaw, deciduous tooth is placed perpendicularly in the jaw, but permanent tooth are placed obliquely in the jaw. This is one more different. Deciduous tooth is straight, perpendicular to the jaw, but permanent tooth has its own, every particular tooth has its own angulation. That we will study in the chapter of occlusion, inshallah, in the last lectures. So it has an oblique placement in the jaw. Eruption shading, deciduous tooth eruption starts at 6 months, are physiologically shed. Permanent tooth eruption at 6 years, no shed physiologically. If lost, this is pathologically lost. Now, I think you have understood about the difference between the deciduous tooth and permanent tooth. Now we'll go through the anterior tooth, deciduous anterior tooth, a brief description, not as detailed as the permanent tooth. A brief description we will give you so that you can easily understand the morphology of the deciduous tooth. Okay. The crowns are shorter and wide in the anterior tooth. Anterior tooth means we are telling about the central incisor and the lateral incisor. The length is equal to width. You see here, the length, cervical-occlusal length and mesiodistal dimension is almost same. The cervix appears more constricted than in the permanent tooth. Here, the cervix appears more constricted. The mesio-incisor angle is sharp and acute, while this incisor angle is obtuse. This is similarly like the permanent tooth. The lingual surface exhibits a prominent cingulum. You see here, the prominent cingulum is present in the lingual surface. The marginal ridges as well as the lingual fossa are shallow. This is tooth A, this is tooth B. Central incisor, lateral incisor. All are almost same. So the basic characteristics is similar like the permanent tooth. That means the incisor angle is sharp and this incisor angle is obtuse, is rounded. But the crown height is smaller, width is bigger, the depressions and elevations are shallow, but cingulum and cervical ridge are a little bit more prominent in comparison to the permanent tooth. Maxillary central incisor closely resembles the permanent successor except smaller, greater mesiodistal dimension than cervical incisor. Cervical ridge is more prominent. Lingually well-developed marginal ridges and cingulum are present. Root length is bigger than the crown length. You see, this is the lingual fossa. Proximally, labiolingual dimension at cervical third only 1 millimeter less than the cervical incisor length. The crown appears thick compared to the length. Okay, this crown, you see, this crown appears very thick in comparison to its height. Root with central developmental depression for the whole length. There is a central developmental depression in the whole length of the root. Inside it, if you see, crown much wider mesiodistal than the labiolingual. This is labiolingual dimension, and this is mesiodistal dimension is much more bigger in comparison to labiolingual dimension. Maxillary lateral incisor, come to the maxillary lateral incisor. Smaller, the central incisor except crown is smaller in all dimensions. Cervical incisor length, mesiodistal is bigger than mesiodistal dimension, and root much longer than the crown. Okay, so maxillary central incisor, lateral incisor is much more smaller than the maxillary central incisor. The crowns are small, narrow, and long. The cingulum, lingual ridges, and fossa are poorly developed. The incisor edge lying on the long axis of the tooth. You see the incisor edge. This is the incisor edge is in straight line with the root axis of the tooth. The incisor angles are sharp. The roots of mandibular incisors are long, thin, and straight. This is mandibular incisor. Mandibular central incisor, similar to their successor except much smaller. Crown is wide in proportion to the length. Root narrow and conical, almost twice the crown length, evenly tapered to a pointed apex. And both in case of central incisor, both the angles, meso-incisor angle, distal angle, both are sharp. In case of lateral incisor, the distal angle is little bit rounded. Mesiodistal dimension from mesial and distal aspect, you see here, they taper evenly from the contact area. Okay, and labio and lingual cervical contours are convex more than permanent. Incisal ridge centered over the root. This is the incisal ridge, you see. The incisal ridge is centered. In case of permanent tooth, the incisal ridge is little bit 1 millimeter lingually placed. But in case of deciduous tooth, it is straight. Mandibular lateral incisor, similar to the deciduous central, except larger for the labialingual dimension. They are similar. Lingual anatomy is more developed. Incisal ridge slopes distally, and distal marginal ridge is more rounded, just like the permanent tooth. Permanent tooth also measure incisor angle is sharp, this incisor angle is rounded, and there is a slope from the mesial incisor angle to the distal incisor angle. So incisor ridge is little bit sloping down to the distal incisor angle. Similarly, like the permanent lateral incisor. Now the maxillary canine. Any question, guys? No.
Oh, so far so good.
Okay. This is one important thing in the maxillary canine. Maxillary canine and the first permanent premolar is a little bit atypical. Although the overall size of the tooth is smaller, it is sometimes easily confused with the permanent canine because of its large crown and thick labiolingual proportions. Because though it is smaller than the permanent canine, but in the deciduous series, it is the biggest crown. So what happens sometimes, the remaining deciduous tooth, if it retains for longer than the usual time, sometimes people are confused that maybe it is the permanent canine, because permanent canine have a variation in size, smaller or medium or bigger. So sometimes they think, oh, maybe it is a smaller variety of the permanent canine. So it is almost same, but in one dimension there is a difference. The crown may be as wide as it is long. It is diamond shaped. The cervical incisor layer height and mesodistal height is almost same. The crown is constricted at the cervix more than the incisor. In case of cervix, it's constricted. The mesial cusp slope is longer than the distal one, opposite to the permanent canine. The permanent canine, here the mesial cusp slope is longer than the distal one. So the mesial cusp slope is more reaching, more cervical. Here, this is bigger. Mesial is bigger than the distal. So mesial contact is more cervical, distal contact is more incisor. This is opposite to normal tooth. This is happening in the permanent dentition also, only for the maxillary first premolar, right? So this aspect, the crown may be as wide as it is long, that I told you. And the main important feature, this is usually one question is coming from here. The mesial cusp slope is longer than the distal one, opposite to the permanent canine, and opposite to the normal sequence. You see here, labial, cervical, incisal dimension and mesodistal dimension is almost same. Constriction at the cervical area. The labial surface is strongly convex, particularly at the cervical one-third. Cervical ridge is very prominent. A longitudinal ridge, labial ridge, connects the cervical ridge with the cusp tip shallow groove lie on either side. This is buccal ridge. The buccal ridge, on the both sides there is shallow groove. The root would be longest of the deciduous tooth. It may be more than twice the crown, twice of the crown length. So this is all the features are almost similarly with the permanent tooth. Only the deciduous tooth root is much more bigger than the crown in comparison to the crown. The lingual aspect. The crown has well-developed cingulum, mesial and distal marginal ridges, as well as cusp ridges. All ridges are less prominent than in the permanent canines. So the marginal ridges, the lingual ridges, everything is much more less prominent than the permanent tooth. Well-developed cingulum is present, mesial and distal marginal ridges is present, and cusp ridge is present. Mesial and distal aspect. The cervical third of the crown is much thicker than in the deciduous incisor. There is a prominent labial cervical ridge. This is prominent labial cervical ridge, prominent cingulum. So the cervical area, cervical one-third is much more wider in comparison to the permanent tooth. The root is bulky in its cervical and middle thirds, tapering most in the apical third. You see, most in the apical third is tapering. The cervical one-third and middle one-third is much more bulky. No tapering is present there. Incisor aspect, outline form is diamond shaped because the buccolingual dimension and mesodistal dimension is almost same. So it is diamond shape. The crown is broader labilingually than the incisor, but it is still wider mesiodistally than the labiolingual. The cusp tip is distal to the center of the crown. This is cusp tip, which is little bit distally deviated from the center of the crown. This is distally deviated, okay, not in the center line. That is why the distal cuspal ridge is smaller than the mesial cuspal ridge. Similar to palmar except, so this is summary: smaller, crown constricted, mesiodistal surface more convex, contact area nearly at the same level, cusp tip sharper and longer, mesial slope is bigger than distal slope, cusp tip more distally placed, root more slender and longer. Mandibular canine, now you come to the mandibular canine. The mandibular canine crown is shorter than the maxillary canine. The crown is much longer than it is wide. So similarly, the permanent canal also, the crown is much more long than its width. So it looks a slender tooth. Slender means which is thin and long. So permanent deciduous canine is also like this. Deciduous maxillary canine looks a bulky tooth, bigger tooth, almost like the permanent canine. But deciduous lower canine, mandibular canine, it's a slender tooth, longer in dimension and much less in width. The crown is much longer than it is wide. The cusp tip may be pointed like an arrow, similarly like the lower permanent tooth. All ridges are not pronounced as those found on the maxillary canines. Okay, so cervical ridge, lingual ridge, buccal ridge, they are not that much prominent like the maxillary canine. Similarly, the same feature we find in the permanent tooth, the elevation and depletion in the mandibular canine is much less than the maxillary canine. The mesial cusp slope is shorter than the distal cusp slope. This is which is opposite to the maxillary deciduous canine. Okay, maxillary deciduous canine is the only exception in the deciduous series, and maxillary first permanent molar premolar is the variation in the permanent dentition, that the mesial slope is bigger than the distal slope. But here, the mandibular canine, it is like any other tooth. The mesial slope is smaller than the distal slope. Why? Because the distal contact point is situated much more cervical than the mesial one. The root is at least 2 millimeters shorter than the maxillary canine. Here, the size of the mandibular canine is much more smaller than the maxillary canine. So, okay, this is about the maxillary and mandibular canine. Now come to one more thing, which is known as primate space, a naturally occurring spacing between the tooth of the primary dentition. In the maxillary arch, it is located between the lateral incisor and the canine, whereas in the mandibular arch, the space is between the canines and the first molars. It also occurs between the canine and the first premolar teeth in adult primates. Actually, primate space is what is happening when our deciduous tooth all come into the oral cavity at the age of 2 years, and they stays up to the age of 6 years. You know, the age of 2 years and age of 6 years, there is a much difference in the size of the jaw, maxilla and mandible. Maxilla and mandible is growing up and having bigger and bigger size, but the dimension of the tooth is unchanged. The dimension of the tooth cannot be changed. So what is happening? There will be some spacing between the two. Usually, the maxillary arch, the space is present between the lateral incisor and the canine, and in case of mandibular, this is usually present between the canine and the first molars. This is the first molar. So this space is known as primate space. This space will be used by the permanent tooth. Why? The permanent tooth is much more bigger in mesiodistal dimension than the deciduous tooth. So we will need this primary space for the permanent dentition. You see here, these spaces help in placement of the canine cusp of the opposite arch. Leeway spaces and primary space together, they compensate for the bigger size of the permanent tooth. Leeway space is another thing that we will explain. What is leeway space? The combined mesiodistal widths of deciduous canine first and second molars is more than that of the combined mesiodistal width of permanent canine first and second premolar. You know, this is another thing. Anterior tooth, we got we got the primary space. Now, if you see the canine, deciduous canine, then deciduous first molar, deciduous second molar. Deciduous first molar and deciduous second molar is much more wider in comparison to the permanent premolar, because premolar is like the canine, right? So what is happening? The combined mesodistal weight of the deciduous canine, the first deciduous molar and the second deciduous molar, is much more bigger than the combined mesodistal weight of the permanent canine, first premolar and second premolar. So as a result, what is happening? This space is known as leeway space. This leeway space, in combination with the primary space, they are giving the room for the bigger or mesodistally wider permanent dentition. Okay, so tooth is becoming nicely set in the permanent dentition without crowding. But in case in any reason, if this primary space or leeway space is lost for any reason, then the crowding starts. So maxilla, it is 0.9 millimeter per segment, 1.9 millimeter in the total. Mandible, it is 1.7 millimeter per segment, that is 3.5 millimeter in total. This is leeway space. So if you have any question, guys, now you can ask me. No question?
Yes.
Okay. So one thing, guys, your what I come to learn from the female section, the coordinator he called me yesterday. Your quiz will be online next Wednesday from 10 o'clock in the morning. 10 o'clock. Okay.
Doctor,
I,
the time.
what? Time. The time is 10 o'clock because they said the male and female leader, they decide the time for 10 o'clock because the doctor in the female side, they are not ready for Bad Zohor. So 10 o'clock, we will have the quiz for 20
Yes,
minutes.
yes, we talk. We talk with them, but I mean the time for the quiz. How many minutes?
Maybe 20 minutes, inshallah. 20 minutes for 10 questions. No worries. Only 10. Just play 10 MCQ questions. No other
20
feedback,
for 20?
nothing.
25, sir.
No, 25 they will not make, they said, because they said this is maximum. They wanted to make it 10 minutes. I don't know. I will talk to them again. Maybe they tried to make it 10 minutes, but I said that it should be 20 minutes. I'm not sure they will make, but I will let you know. Okay, no worries. But
Oh, they needed 10 minutes for 20 questions?
no, only 20, not 10, only 10 question. Online is only 10 question.
Oh, and 20 minutes.
No, look, they are telling 10 question, 10 minutes. I proposed for 20 minutes. I'm not sure they will make it 20 or 10, but they will let me know. They say that I will discuss with the other coordinators and let you know. Okay.
Please,
So
Doctor, 20.
only 10 question, 10 MCQ. MCQ. A, B, C, D, you will just
Doctor,
choose. You don't need
the
much more.
question must, you must understand the question. You need
Yes,
more time.
I know.
You
That's
need
why
to
I
read the
proposed
question
for 20
carefully.
minutes. Let me see. They will let me know in this week, inshallah. No worries. I will let you know. Okay.
Okay, thank you, Doctor.
Time is 10 o'clock in the morning. So our lecture will be as usual 11 to 12 because in the class routine it is 11 to 12. So this week, next week, inshallah, we'll take the quiz from 10 o'clock and we'll make the lecture from 11 o'clock. Okay.
Okay.
Okay. Thank you very much. So if you have any question, you can ask me now.
Doctor,
Yes.
if there is caries on the deciduous teeth, there is possibility to decay the permanent teeth below, or no?
No. Usually, if there is caries will not go to the permanent tooth. Why? Because there is a bony barrier between the permanent tooth and the deciduous tooth, which is known as caries. So caries will not go. But if there is inflammation, recurrent inflammation due to exposure of the pulp and infection of the pulp of the deciduous tooth, if there is big infection, periapical lesion, sometimes it affects the permanent tooth jam. When, for example, the deciduous tooth is going to be shed and permanent tooth between the bony barrier between the permanent tooth and deciduous tooth has been lost, permanent tooth is going to erupt. But at this time, for example, 6 months before the eruption, the bony teeth is broken down. that there is a huge infection in the deciduous tooth. This infection may cause damage to the permanent deciduous tooth. Permanent tooth germ. You understand?
Yes, please.
Usually there is a bony barrier between the permanent tooth germ and the deciduous tooth. So usually caries cannot go there. But during the eruption time only, if there is a huge infection or inflammation in the deciduous tooth, that may affect the permanent tooth. Sometimes we may have, you see, the dentition teeth and this and that. This may happen. Okay. Anything else?
Okay.
So can we finish the meeting, inshallah? Okay.